I'm Julie Wilson, a pediatric sports medicine physician and co-director of the concussion program at Children's Hospital Colorado. Today, I'd like to share some of our research and tell you how we are advancing concussion care for our patients. Concussion care and research have evolved rapidly over the last 20 years, and we still have much more to learn. One of the ways that the concussion program at Children's is working to further understand concussion is by having our patients enrolled in a clinical registry. This allows us to standardize the information that we are collecting from our patients and analyze large groups of data to help inform clinical decision-making. Recently, we examined registry data from over 900 patients seen by our sports medicine physicians in the concussion program. Here are a few things that we have learned and how we are using this data to impact patient care through a comprehensive approach to concussion management. Neck pain is a common symptom reported by patients who sustain a concussion, and in our registry data, 54% of our patients reported neck or shoulder pain at the time of their initial evaluation. These patients were found to have a higher initial concussion symptom rating and were more likely to miss at least 5 days of school and have post-injury sleep problems compared to patients without neck or shoulder pain. In addition, patients with neck or shoulder pain at initial evaluation required a longer time for concussion symptom resolution and return to sports participation. A careful neck examination should be conducted as part of a concussion evaluation, and patients with neck or shoulder pain may need diagnostic imaging or referral to physical therapy to help address their complaints. Referring providers should be aware of the potential impact of neck and shoulder pain on concussion outcomes. Our concussion program is fortunate to have a team of physical therapists who provide expert care to our patients in helping them recover from their injuries. In the future, we hope to use our clinical registry data to help us evaluate the optimal timing for patients to start physical therapy after a concussion. In a subgroup of 225 patients seen within 2 weeks of concussion, we found 36% of patients reporting sleep problems which developed after their injury, such as trouble falling asleep, waking up more than usual, or other altered sleep patterns. Only 5% of patients reported similar problems prior to their injury. Patients with post-injury sleep problems had higher concussion symptom ratings, worse headache severity, and longer duration of concussion symptoms by 7 days compared to patients without post-injury sleep problems. These results reinforce the importance of screening patients for sleep problems and providing recommendations to help improve sleep patterns, which may in turn impact concussion recovery. A frequent question asked by patients in the setting of concussion is, how long will it take for me to recover? While we haven't figured out how to predict the exact duration of symptoms for each patient, we are working on ways to identify patients who may be at risk of prolonged symptoms. In a subset of 351 patients seen within 10 days of concussion, we found that loss of balance on the Romberg test was independently associated with longer concussion symptom duration. Thus, we find it important to pay close attention to the results of postural stability assessments, as this may indicate patients who would benefit from additional workup or specialty care during their recovery. Historically, the cornerstone of treatment for concussion was thought to be physical and mental rest. However, in recent years, we have come to understand that strict or excessive rest is not helpful to recovery and may actually be detrimental. Current guidelines emphasize a more active approach to concussion recovery while still keeping the patient safe from activities where repeat head injury might occur. Work piloted by Dr. John Leddy, a concussion researcher at the University of Buffalo, has demonstrated that aerobic exercise can be a safe and effective means of facilitating concussion recovery when done in a supervised and individualized manner. We analyzed our concussion registry data to understand the proportion of patients engaging in early physical activity, defined as physical activity occurring after the concussion but prior to their first appointment in the concussion program. We observed that patients participating in early physical activity demonstrated lower concussion symptom ratings, shorter symptom duration, and better balance testing results than patients who weren't participating in physical activity prior to their first appointment. However, only 12% of our patients reported engaging in early physical activity, which highlights an area for improvement in concussion care, as we can educate patients, families, and referring providers about the role of physical activity in concussion recovery. This work has led to the development of an upcoming project where we will be offering exercise testing and prescription to all patients seen by our sports medicine physicians in the concussion program. We expect to build confidence of our patients in knowing how to safely exercise after concussion, and we'll be measuring how this impacts concussion recovery. Stay tuned for future updates from this work, and thanks for listening.